I fell in love with the program right away.
Plainview Hospital has a very nice family feel.
I think to be a good doctor, you have to have the entire experience. I knew I wanted to be in a place that fosters learning, teamwork, friendship, all of that.
My name is Michael Fenner. I'm the Executive Director of Plainview Hospital. I've been here for about 20 years. The size of Plainview Hospital gives us some unique perspective. We are a 200-bed licensed hospital. We have a robust ICU with full-time intensivists that allow for a huge amount of educational opportunities. At the same time, you get to know everyone you work with because you see a lot of the same faces, so it really has the best of both worlds. We do have the backing as being part of Northwell Health, of a huge institution with a medical school and many other resources and opportunities.
Plainview is a community hospital right here in the center of Long Island.
Most of the people who work here also live in the area. They're treating their hometown community.
Plainview is very tight-knit.
We know each other, you walk through the hall, most of the nurses. You see a specialist and you're not afraid to go up to them and ask them, hey, can I talk to you about something?
Like most community hospitals, we have a large elderly population, but we have many young patients as well who come through for various elective procedures.
Being so close to New York City gives us a patient population that's so diverse.
Sometimes when you're in a residency program, you really don't get a thorough grasp of all different walks of life, and here I feel like you really do.
The residency program here at Plainview Hospital is really one of our gems we're very proud of. There are over 60 residents between all of the programs each and every year as they rotate through to the various sites.
I am Christopher Watt. I am the program director for the transitional year residency program. I oversee the training of 10 transitional year residents who will be going on to other specialties. I trained in this hospital as a resident in family medicine. This is where I cut my teeth as a physician. The residents are very well integrated into the hospital. They're involved in every facet of providing care. People look to them for leadership.
My favorite thing about this program is that as a transitional year, we get 10 weeks of elective time. It's been a little bit over a month, but I've already been on 2 electives. So I've done wound care for 2 weeks, which I think is relevant to my next field. And I'm also currently on a PM&R, physical medicine and rehab rotation. So I'm getting a lot of exposure to different fields while I'm here, so it's a great program.
We really pride ourselves on focused mentoring and focused career goals, tailoring one's education once they're beyond the common core requirements for training, and letting them use their elective time and helping them create opportunities that they might not otherwise have.
My name is Peter White. I'm a second-year orthopedic surgery resident at Plainview Hospital. When I was looking for a program, one of the most important things for me was to get a kind of a diverse experience, access to both academic and community settings, which really would give me the experience to figure out where I was going to kind of fit in down the road. Our residency, we cover 4 different hospitals, 2 of which are ranked in the top 50 hospitals in the country. North Shore University Hospital, Huntington Hospital, Plainview Hospital, Long Island Jewish Valley Stream, and they're all close to one another. We work with over 50 attendings, which is a huge number. You really get to see all subspecialties. You get to see so many different ways to do the same procedure. You really have the opportunity to find your own mentor, the person that you really click with.
I would say that our faculty here is extremely committed to the mission of educating residents. Many of us came through the programs ourselves and stayed on, which I think is a real testament to the programs.
The family medicine program here at Plainview is definitely special. I knew I wanted to do family medicine because, it's all-encompassing. We have a really good inpatient experience. Having a good inpatient experience makes you a better outpatient doctor because you know how to deal with the sickest patients. The other thing that I really like is that we work at Huntington for OB, so we get an experience at another Northwell facility. You get PEDS experience, both outpatient at the Dolan Center and inpatient at Cohen's. So you get a lot of experience at PEDS hospital.
The attendings hold you to a high standard. They expect you to meet certain expectations, to really do your job well every day, to come in ready to work and ready to learn.
It is a culture that makes you feel like you're included. You never feel lost in a sea of people. You always feel like you're part of a team, and I love that.
They let you grow. They let you make your own decisions. They ask you your opinion, and they listen to you.
I've also found, as somebody who has a big interest in research, there's a vast infrastructure here for getting involved with that. At the Feinstein Institute, you really get that sense of self-confidence, whether that's going to conferences or just getting published or just just for the pure intellectual curiosity, you have those opportunities.
The programs here all share in common that they want to help residents get to where they want to be. Being in a small community hospital, the residency programs are unopposed, which means a higher volume of pathology cases to learn from, the opportunity to fully manage a patient without competition from other residency programs and having to divide the cases. That paired with being part of a larger organization like Northwell is really huge. We have resources like the Center for Learning and Innovation, the BioSkills Lab, where residents are able to practice procedures on cadaveric specimens, so they're working on real human tissue, which is really incredible. We have been successful in integrating telemedicine into our practice here. We recently just developed a virtual rotation. I think it's something that's very innovative, so this has been a really exciting opportunity.
I think someone who's considering Plainview should really think about the community that they're wanting to serve, but also the type of lifestyle and work environment that they want to have. From the attendings to the residents, everyone really enjoys working here. That's the key that really helps Plainview stand out.
Medicine is changing. I think that we can train amazing, very strong physicians and also give them a good quality of life, a nice work-life balance.
Quality of life is really great here. I never feel like I'm being overworked.
We recently implemented a wellness program, so we have 4 wellness days for every resident outside of their regular vacation time per program.
We really enjoy getting together outside of work. We do things together and we plan events together.
The proximity to New York, to the city, it's good for us in like the social sense, so we get to go out and explore. I feel like the friendships I made here are like life-lasting.
One of the things I love most about working with residents is the opportunity to truly train the next generation of medical professionals.
We all feel a very strong sense of ownership over the hospital, the care that's provided here, and the success of the residents in their efforts to move into fellowship programs or specific careers after finishing.
Over the last 20 years, I've seen residents come in as fresh graduates from medical school and then turn into amazing physicians. And some of the beauty of our program is so many stay in the community. You continue to see them grow as community physicians, as well as faculty who continue to teach the next generation of students.
I gained a lot of confidence, I would say, over the year. My senior residents really helped me out. Everyone just roots for each other. Everyone wants to help each other. And, that sort of community is what I was looking for.
Plainview is a really awesome place to work. I'm glad to come to work every day. I enjoy the people that I'm working with every day. I'm learning something every day.
I think that the supportive nature of this program and all the faculty that we work with really is going to prepare me well for going onward. Come into work every day and you're enjoying yourself, making people better. So it really is just a tremendous feeling.